ulnar tunnel syndrome, anatomy of the canal. Floor is transverse carpal ligament. Ulnar wall is made by pisiform. Radial wall is made by hook of hamate. The roof is formed by the volar carpal ligament. It contains ulnar artery and the nerve. The ulnar nerve bifurcates here into a superficial sensory and deep motor branch. Nerve here supplies hypothenar muscles and the palmaris brevis. The cause is repetitive indirect trauma, ganglia from the triquetrahamate joint, causing a space-occupying lesion, fracture of the distal radius and ulnar hook of hamate, ulnar artery aneurysm or thrombosis, piezotriquetral osteoarthritis, pisiform instability, and inflammatory arthritis. Presentation: sensation on the ulnar side of the digits is reduced. Decreased sensation in ulnar 1.5 digits. The power for FCU and FTP is ulnar FTP is fine. Clawing of the ring and little finger is there because of loss of intrinsic muscles. Weak grip, loss of MC joint flexion. You have to check for key pinch, weakness of finger crossing, card test for palmar interossei adductors, foramen test should be done. FPL, that is median nerve compensate for weak adductor pollicis. Wartenberg sign, persistent small abduction, finger abduction and extension during limit attempted adduction. Weakness of third palmar interossei and unopposed EDM causes Wartenberg sign. Weak opposition of little finger. The compression site, zone 1, proximal to the bifurcation, both motor and sensory are involved. Zone 2, deep motor branch and motor symptoms are only, that is due to mostly thrombosis of the artery. Zone 3, superficial sensory branch, sensory symptoms are only present. So zone 1 has both motor and sensory, zone 2 has motor only, and zone 3 has sensory only. Nerve conduction studies show delayed latency from wrist to first dorsal interossei. MRI if you suspect space occupying lesion. Management conservative and avoidance of repetitive trauma. Surgery is decompression. Tendon transfer can be done for clawing to stabilize MCPJs and cholecapsulodesis, and FD's looped volar to A1 pulley and sutured back to itself.